In recent years, an alarming trend has emerged in the realm of cancer diagnosis. Doctors and researchers are witnessing a significant increase in cancer cases among young adults, both in the United States and globally. This phenomenon is perplexing medical professionals and spurring a search for answers. A startling statistic reveals that in the United States, the incidence of cancer in individuals under 50 rose to 107.8 cases per 100,000 people in 2019, up from 95.6 in 2000. A similar trend is noted worldwide, with higher rates observed in North America, Australia and Western Europe. This uptick is not restricted to a single type of cancer but spans various forms, including colorectal, pancreatic, appendix, stomach and uterine cancers. The question arises, what is driving this increase? Researchers speculate that lifestyle changes over recent decades could be a factor. These include less physical activity, a rise in the consumption of ultra-processed foods and exposure to new environmental toxins. However, pinpointing the exact causes remains a complex challenge. The personal stories of those affected bring this issue into sharp focus. Take, for instance, the case of Maylene Keane, a 27-year-old diagnosed with gastric cancer. Her journey from initial symptoms to undergoing chemotherapy and stomach removal underscores the profound impact of cancer on young lives. It highlights not only the physical and emotional toll, but also the disruption to life plans and aspirations. The death of actor Chadwick Boseman from colon cancer at the age of 43 brought widespread public attention to this issue. It underscored the realization that younger individuals are increasingly at risk and that early detection is critical. In response, medical guidelines are adapting. There is a push to lower the recommended ages for cancer screening, recognizing that earlier detection can significantly improve outcomes. However, the challenge remains significant as many young patients are still diagnosed at later stages. Research efforts are intensifying to understand the underlying causes. From lifestyle factors like diet and physical inactivity to environmental exposures, the scope of investigation is broad. Intriguingly, even factors such as the method of birth have come under scrutiny for their potential role in increasing cancer risks. These developments underscore a pressing need to unravel the complexities of cancer in young adults. It's a puzzle that demands a multifaceted approach, combining medical research, public health initiatives, and awareness campaigns. The goal is clear: to stem this rising tide of cancer in younger populations and safeguard future generations. As we continue to confront this challenge, the stories of those affected remind us of the urgency of this quest. It's not just about statistics, it's about real people, their struggles and their hopes. By understanding and addressing the factors contributing to this trend, we can hope to see a future where cancer is no longer a predominant concern for the young.